We perceive almost 80% of the world around us by using our sense of sight. We will see two different types of object. One is luminous object, another one is non-luminous object. Some objects generate their own light, that is called luminous object. Example, sun, fluorescent bulb, burning candles. Another one, non-luminous object. Some object cannot generate their own light, that is called non-luminous object. Example, table, chair, wall, paper. We have already seen light lesson part 1. What did you see in last class? Reflection of light. What is law of reflection? Two different types of reflection. First law of reflection, second law of reflection. Next, how is an image formed in the plane mirror? Characteristics of image in a plane mirror. What is lateral inversion? Reflection of light from regular and irregular surface. Today we will start next topic. Today first we will see dispersion of light. A ray of light entering a glass prism is split into its component colors of red, orange, yellow, green, blue, indigo and violet. This is the spectrum of white light. The splitting of white light into its component colors is called dispersion of light. Next, we will see why does white light disappears into light of 7 colors. Light travels in a straight line. A ray of white light that falls on a glass prism does not continue to move along the original path after it enters the prism. The path of the ray bends. This is known as refraction. In this case, air and glass are two different media. After passing through the prism, when the ray emerges out, it diverges again. Every time the light moves from one media to another, it refracts. The color in white lights are separated because the glass bends each color component of the white light differently. Next, very interesting topic, human eye. The human eye is a complex optical device created by nature. It helps us to think, discuss colors, size and preserve depth and direction. Now, to understand the function of the human eye, let us first learn about its structure. The human eye is held in position by muscles. Next, very interesting topic, human eye. The human eye is a complex optical device created by nature. It helps us to see things, discuss colors, size and preserve depth and direction. To understand the function of the human eye, let us first learn about its structure. The human eye is held in position by muscles. It is warped in 3 layers of tissues. First one, the sclera. Second one, chordoid cord. Third one, retina. Next one, structure and its function. First one, cornea. The outermost transparent layer of the eye is called cornea. Second one, iris. The ring-shaped membrane is called iris. It increases and decreases the size of the pupil. Third one, pupil. Light enters into the eye through pupil. Fourth one, convex lens. It covers the light to the retina. Fifth one, retina. Retina has 2 light sensitive cells. One is rod cells, another one cone cells. First one, rod cells. They respond to the intensity of the light. Because rod cells, we are able to see the things in dark, but no color in seen. Second one, cone cells. They respond to the color of the light. Because cone cells, we are able to see colors. Sixth one, optic nerve. Retina sends image signal to mind through optic nerves. Seventh one, blind spot. The junction of retina and optic nerves is called blind spot. At blind spot, there is no rods or cone cell. So, light fallen on its spot is not seen. Hence, it is called blind spot. Next, last one, yellow spot. It is the area of maximum amount of rod cell and cone cell. The image formed at this spot is most clearly image. Next, reaction of the pupil to different light intensities. You will observe that the size of the pupil changes according to the intensity of the light. When it bright light, the pupil becomes small, blocking out too much light from entering the light. In darkness or less light, the pupil becomes big and allows more light to enter the eye. This is the reason why you cannot see too well when you come indoors after being out in bright sunlight. Daily we will see different types of things. How do we see? Light rays enter the eye and are bent as they pass through cornea, aqueous humor and vitreous humor. The ciliary muscles change the shape of the lens to focus an inverted image onto the retina. The sharpest image is formed at the fovea. The light sensitivity rod and cone cells are densely packed in this part of retina. Rod regulates vision in dim light, but cone regulates color vision. The cone cells contains colored pigments, so observe color of the light. It causes chemical changes in the pigment. They releases some energy. This energy is turned into an electrical impulse and is carried by the optic nerves to the brain. The brain analyzes the impulse and this is how we see. Why are some people unable to see clearly? Normally, the eye can focus an image exactly on their retina. Eye defects occurs when the focusing is not perfect. First one, near-sightedness or myopia. Near-sightedness is an eye defect. A person with this defect is able to see closer objects but has difficulty seeing objects that are far away. This is because the light rays coming from a distance are focused in front of the retina. This is caused by the eyeball that is too long. Nearsightedness is corrected with a concave lens. Concave lens causes the light to diverge slightly and focus on the retina. Second one, farsightedness or hyperpopia. A person with farsightedness has difficulty seeing objects that are near. This is because the light rays from a closer distance become focused behind the retina. This is caused by an eyeball that is too short. This is corrected with a convex lens. Convex lens converges light and focuses it on the retina. Causes of blindness or loss of vision. As a person ages, the eyesight is affected. Retina regenerates. As a result, the person has difficulty in reading. Diabetes, cataract, and glaucoma are other causes of blindness in elderly people. Cataract. Acquired opacity in this lens or lens capsule is called cataract. Cataract is caused due to the opacity in the lens of any eye, leading to blurring of vision. It can occur due to damage to the lens, old age, or disorders such as diabetics. Cataracts can be removed by surgical methods. This lens is replaced by implanting an artificial lens. Next, third one, poor nutrition, night blindness. What is night blindness? Night blindness is the inability to see well at night or in the poor light. It is not a disorder in itself, but rather a symptom of an undiscerning disorder or problem, especially untreated myopia. A person suffering from night blindness loses the ability to see in dim light. It occurs the level of the light sensitivity molecules in the rod cells of the retina are low. During daylight, there is enough light simultaneously to allow vision. Despite low levels in retinal rod cells, the first sign of the night blindness is the dryness of the conjunctiva followed by softening of the cornea. If not treated at this stage, tissues damaged can occur and lead to total blindness. Night blindness is caused due to vitamin A deficiency. Example, carrot, papayas, pumpkins, liver, fish and vegetables. We will see last topic, color blindness. Color blindness are not blind, have abnormal color vision, unable to discuss between certain colors. It is an inherited defect.